Department of Health, Mike Abrams, Hospital Association, as well as Dr. Andy Thomas and Dr. Larry Blosser, and they all will be speaking. Thank you all for joining us this Saturday afternoon. We're here today to update people of the state of Ohio, and specifically to talk about our statewide testing process for COVID-19. While the situation certainly remains fluid, we have a plan, and we are implementing that plan now. Certainly the safety and well-being of all Ohioans is our most important consideration. And we're here this afternoon to walk through for the media and for the public our statewide effort to ensure that those most in need of testing of COVID-19 do in fact get a test. As of today, here are the essential facts. Ohio still has no confirmed cases of COVID-19. No confirmed cases as of this moment. We have had 9 persons under investigation, referred to as PUIS, who have all tested negative. We currently have 5 persons under investigation where the test is in the process of being done, and we are awaiting those results. Starting today, the Ohio Department of Health will start posting data 7 days a week instead of 5 days a week about the number of PUIs in Ohio. The state of Ohio now has the ability to test cases. The Ohio Department of Health has started testing, and we expect to get results within the next 24 hours. The turnaround time we expect generally from the Ohio Department of Health will be 8 to 24 hours when those tests are done. But in addition to the state, the private lab called LabCorp also has the ability to test now in Ohio. And the private lab Quest Diagnostics is expected to be able to test as of Monday. Further, we would expect some hospitals to be able to do testing within approximately 2 weeks. What is important here is this: regardless of whether the Ohio Department of Health or a private lab or in the future a hospital does the test, the results will go back to the Ohio Department of Health. They will maintain the data to best track the possible community spread of the disease. The Ohio Department of Health does have a limited number of tests, between 300 to 400 people, the ability to test between 300 to 400 people. The private labs also, of course, will be able to increase that number of those who can be tested, and again, in a few weeks, we will have some of the hospitals in Ohio who will also be able to add to that capacity. We are making the most out of what we have to best maximize our testing ability through our plan to prioritize who gets tested. Dr. Acton and our Ohio Department of Health are working closely, and I want to emphasize this because this is a health system in the state. They're working very closely with local public health officials, working closely with hospitals, with primary care doctors and nurses and nursing homes, in a system-wide effort to maximize our ability to test Ohioans. Should Ohio have confirmed cases of COVID-19, our plan addresses the sickest and most at risk, as well as people who are less sick and not needing hospitalization. Let me now turn it over to Dr. Acton, who will speak in more detail about our statewide plan. After that, we will hear from Mike Abrams and from Dr. Andy Thomas and from Dr. Larry Blosser.
Thank you, Governor. Good afternoon, everyone. I appreciate you coming together on such short notice. We know, once again, that there's a lot of fear, a lot of confusion out there, so we thought if we shared with you a little bit more about the testing process and what we know now, it might help your viewers, the people out there watching this, have a better understanding. So the truth is there is a limited amount of testing we can do right away. That amount is going to grow every day, so our capacity will build. But in the beginning, we really must prioritize those that are most sick. The good news is our lab is up and running now, Ohio Department of Health's lab. And what is also different in Ohio is in part of our preparation, we really went out of our way to make a lot of connections with our health systems and with our primary care docs. And today, we are releasing a lot of guidance through our networks that we built in planning for this. So we are all working together to maximize the resources for Ohioans. And the doctors will be sharing more with you about that. So the good news also is that all of the lab test results do come to ODH immediately. This is a Class A reportable disease, and so we will be seeing all those results and being able to take responses as a state very strategically. So we're taking in Ohio a three-pronged approach. First of all, we are going to prioritize those at highest risk for having consequences of this disease. As I said all along, most people, over 80% in the science we have now, will be able to stay at home, and believe me, we want people to stay at home if they're sick with this, just like they would with the flu. So we're really going to prioritize the elderly, people who have pre-existing health conditions, those who are immunocompromised, and actually our healthcare workers. As you've seen in other states, healthcare workers, sometimes our frontline workers like EMS and fire, are first out on the lines and exposed, so they will be prioritized. Those tests will be directed to the Ohio Department of Health because we have the capacity to turn those around the most quickly. But then there will be a second group, and that second group is the rest of us. And if we get sick with this, and as the doctors will explain to you more, we will want to call our doctor or use our telemedicine or call our nurse helpline and talk to them about what we're experiencing. And then you will engage with your doctor as an outpatient, and they will do a thorough examination, and then they will probably want to rule out things that are more common, like the flu and the other respiratory things we see. And then, only with a provider's order, and those providers, as we know, are nurse practitioners and physician assistants and doctors, they will then make an order for a test. So that test has to be with a doctor's order. It's not available just ubiquitously. And then those tests, whether they go to those private labs, LabCorp, Quest right now, more are coming online every day. Soon, in 2 weeks, hospitals might be able to do more of that in-house. Whether it's done privately or whether it's sent to my lab, we'll gather all those results and we'll make our strategy. So the other thing, the third part of the prong, is what I'm going to call sentinel surveillance, which means we're going to try to get, in this early stage, a sense of community spread. While we have no cases, and we do have some PUIs pending, we do know most likely from what we're seeing in other states that there is community spread in our country. So we are going to be doing something that epidemiologists do. We have something called a network about influenza-like illnesses, and it's a federally funded program where we look at some of our flu data that's out there, and we're going to do some sort of looking for clusters, unexpected clusters of things that test negative for the flu. It's sort of a complicated process, but it's our way of trying to see if there's community spread. So this is a very well thought out plan. I'm very proud of our state. I'm proud of our epidemiologists because, as you know, in this situation, we're sort of having to create a process that doesn't really exist. And so I feel our state is very well prepared and is being very strategic by having this three-pronged approach. And so local health departments are working from this playbook. Hospitals, nursing homes, we're giving guidance as we speak to our primary care doctors, going out through all our networks. So we're really going to guide folks. But for those of you at home, I want to give you two resources, and also our providers out there, because I know, again, a lot of providers are wondering what to do. In addition to the mailings and the emails you'll be getting, always go to one place for your information in Ohio. It is coronavirus.ohio.gov. And we have also stood up a call center, just started yesterday, a call center where anyone can call in with their questions, and that number is 833-4, the number 4, Ask ODH. So 833-4 Ask ODH. And again, I know there's so much fear and so much confusion. We'll try to talk to you through that. But remember, just like when you're sick with the flu or a cold, the first thing you want to do is reach out to your provider. The other new things are that we're posting our PUIs every day now. We were doing it 5 days a week, but none of us are resting on the weekends with this, so we will be giving you that information as we know it. We are also in our state going to tell you a lot about our testing process. That's another complaint I think people are hearing about in the media. And as we start testing, we're going to tell you everything we can about what we're doing. And again, the private labs will be sharing that information as well. Most of all, I want to say, this is an outbreak. It can be labeled a pandemic. In a pandemic, there are going to be disruptions in our daily lives, and there's going to be confusion. And that's why it's so important you go to trusted information, the sources I've given you, and reach out to your provider for more guidance. And we will guide you through this process with everything we know as we know it. And at that, I'll take questions later, but I'd like to allow you to talk to Mike Abrams, who is the CEO of the Ohio Hospital Association.
Mike.
Thank you, Dr. Acton. I think you guys can guess which one up here is not the doctor, the uniform, but yeah. I've been involved in some situations like this across a couple states in my career, and I want to say that I don't think I've ever seen a better example of strong, measured, and competent leadership than what our state government is exhibiting here in Ohio. When this came up, the governor called us immediately and assembled what we quickly began to refer to as the dream team of experts. And this team communicates very, very regularly. It feels like constantly. He's established a set of people with national reputations, not only in infectious disease, but also operational expertise and deep government experience. Hospitals across Ohio are going to be considering strategies to manage lots of issues, including possible surges in patients, supply chain issues, staffing issues. There are lots and lots of things that hospitals are working every day to kind of prepare for. When healthcare gets interesting from a public health standpoint, there are always lots and lots of oars in the water. And that's the case with this as well. And part of our job is to make sure that all of those oars are rowing in the same direction in concert. And that will result from constant attention by trusted leaders. There are 255,000 people in Ohio who work directly for their community hospital, and the Ohio Hospital Association, in partnership with our 236 hospitals, we're working tirelessly to make sure that everyone feels well communicated with and that they understand the strategies that Dr. Acton has described for you. Every state will have limited resources to deal with this situation. We have a solid plan to optimize the use of those resources, and we can have confidence in that plan because of the experts who I mentioned earlier who have informed the components of that strategy. As you can imagine, I'm in regular communication with my counterparts throughout the country, hospital association presidents in every state on this issue. And as I said, all of them have resource allocation challenges, but I don't think anyone is coordinating the situation any better than we're coordinating it in Ohio. So, Governor, thank you, and Dr. Acton for your leadership on this.
Thanks, Mike.
Good afternoon. I'm Andy Thomas. I'm Chief Clinical Officer for the Ohio State University Wexner Medical Center. Just want to take a moment to echo the comments of Dr. Acton and Mike Abrams. I think the plan that's being put together in the state of Ohio with regard to testing will be a big step forward to both help patients as well as hospitals and providers know the exact steps that they need to do to help patients find out whether they have COVID-19. The increase in testing capacity, both within the ODH and currently within commercial laboratories, is a huge step forward. And over the next 2 to 3 weeks, multiple hospitals across the state will be standing up the ability to complete those tests at their facility. The difference in this progression over time is we've been able to do swabs at the local level, but in the past we've had to send them through ODH to Atlanta to be tested. And as many of you have heard, the turnaround time for that has been days, on a matter of days, if not a number of days. Now that the test can be done in the state for the sickest patients, that turnaround time will be significantly shorter, within a day, as you've heard. Even through the commercial labs, we think at this point it will be a couple of days for a turnaround time for those tests for less sick patients. As hospitals bring this testing online within their facilities, that turnaround time could be as short as 4 hours, or in many cases even shorter. The ability to find out sooner that you have this is a benefit to that patient, a benefit to the providers caring for them, and for the patient's families. One of our goals in being here today, both I'm a primary care physician myself as well as a hospital leader, is to make sure we're getting the message out to the healthcare community, physicians, advanced practice nurses, physician assistants, who are on the front line when patients start calling the office on Monday asking about testing. So our goal is to make sure that those frontline providers know what to do. First and foremost, we need to be making sure that they know how to screen patients to see who is at highest risk. In the past, we've been able to use international travel and exposure to a confirmed patient as one of those risk factors, where now that there is spread within the United States, that international travel is less valuable as a screening tool. So you can certainly use domestic travel for that. And then also obviously screening for symptoms. Fever specifically is very important in diagnosing the disease, but also cough, shortness of breath, and some other symptoms that patients can develop. So if you have a patient who has a travel or exposure history and symptoms, or even with community spread now, just symptoms, the best step is to make sure the first thing you do as the patient even walks into the office is put a mask on the patient, just a routine surgical mask. If there's one thing you can remember, if a patient calls your office and has a cough, you need to be prepared if that patient's coming in that day to put a mask on them immediately and get them into a private room. Then you can work either with your local hospital, your local health department to determine the best next step for testing. If that patient is severely ill, they should be sent to the emergency department locally to be managed. If that patient has mild or moderate symptoms, as Dr. Acton mentioned, 80% of the patients with this condition are going to be sent home. Those patients most likely can either be tested in that doctor's office if they have the appropriate personal protective equipment to be able to get the swabs, or they can be sent either to the local hospital or to the local health department for that testing. But you need to coordinate that with the local providers. You don't want to be sending patients just to the ER to be assessed without talking to someone ahead of time to know that the patient's coming. So the other thing I will emphasize, as Dr. Acton mentioned, there is a requirement that there be a provider's order to have the testing done. So for patients in the community, this isn't something you can just walk up to a lab and ask to be tested. You have to be evaluated by a physician, either over the phone, through telemedicine, or in person, a physician, advanced practice nurse, or a physician's assistant to get an order to be tested. So we think with the coordination really being done by the Ohio Department of Health through our hospitals, our local health departments, and our physician practices, we think we have a solid plan to move forward over the next few weeks as our testing capacity increases, so that we can make sure that we're doing our best to protect the citizens and our patients for the state of Ohio. Thank you.
Afternoon, Dr. Larry Blosser. I'm the outpatient medical director for Central Ohio Primary Care Physicians, and I'm a primary care physician by training. I think you've heard a lot of what I would tell you as well, but I'd like to highlight a couple of things. I'm very thankful that the governor and the Ohio Department of Health are as engaged as they are. As a primary care physician, kind of on the front line, the lack of information can be a scary thing. And I think the amount of information that we've been getting has been very helpful, and the information that will be pushed out today and going forward will help us to understand how we take care of patients and how we utilize our resources. I think for patients, what I would stress to you is call your healthcare provider before launching into doing anything. It's going to be very helpful if you talk to somebody who's knowledgeable. Information on this infection evolves day by day and hour by hour, and you should rely on someone who has access to that information to help you make the right decision about what to do next. And for the primary care physicians in the state, I'm encouraging you to take a very good history, try to manage these patients in the setting that they're in their home, assess who really rises to a level of needing further evaluation in a facility. Be careful. This would be a great time to try to leverage telemedicine if you have that capability. Find ways to interact with patients without necessarily being face-to-face. And just a reminder that if you have someone that you suspect may have COVID-19, communicate with wherever you plan to send them before you do. This needs to be coordinated, need to understand how to manage that patient in a way that keeps the patient safe and also protects the rest of the people that might be in that facility. Thanks.
Any questions?
I was wondering, like with telemedicine you were mentioning, doesn't that mean, I mean, if they could do like a swab, then there will be an in-person contact, correct? Like what does telemedicine do to help?
Telemedicine would allow you to, sorry. Telemedicine would allow you to triage who really needs that swab. It allows you to understand the severity of illness. As has been mentioned, a lot of cases are relatively mild, may not need testing, may be able to be treated at home in that environment. So telemedicine allows you to triage the patient effectively.
Are we now just doing some COVID-19 confirmations based on patient symptoms like they did at a certain point in China, or are we still testing only to confirm?
Laura, I'm not sure I understand. Could you just say that again?
So if it's mild, like he said, and you don't need to come in and get a swab, I mean, will we ever know if that person had COVID-19 because it's not going to get confirmed? Or are we like China where at some point they just started based on symptoms?
So, like I said, we're going to be prioritizing testing the people that are sickest. And then of the people who are sort of not needing hospitalized, a lot of it is ruling out the other causes because as we know, we're in flu and cold season. So they'll try to rule out the other causes. I'm going to take a moment here and share a fact. Coronavirus is a cause of the common cold. It's a different type of coronavirus that we're after here. So there's a whole grouping of coronaviruses. And I know there have been some people scared out there. They get a respiratory panel and you see the word coronavirus, and that's why it's so important. A doctor kind of interprets your test results with you because it's a beta, it's a certain grouping within the coronaviruses that is this specific new novel virus. And so there is a little confusion out there, and we have some information on our website about that. But you're going to see this gradually. We've talked a lot about the pandemic and how this spreads. Eventually this will spread in the community. And eventually it might be something that gets tested for the same way as flu every season and be part of a respiratory panel. And there will be many people who have this and might feel a little under the weather, soldier on, but never know they ever had it. And so I think you'll see this natural progression as this outbreak spreads. We're going to be doing a lot of testing now. Eventually testing will be almost routine. We at ODH won't do it. We don't do flu testing. That's all done in hospitals or in private labs, but we're the ones who collect the data and do the surveillance on it. So you're seeing this gradual shift as that occurs.
Dr. Acton, could you sort of explain, so I'm assuming that there are people who go into the doctor and they say, I have this symptom and this symptom, but if they don't really fall on the list of prioritizing or anything, do you track those issues too? Do doctors maybe send you information, hey, there's somebody who's possibly this, they can't get a test right now?
Right.
What do you call that, and do you track those issues as well? Or?
I think doctors, what they'll be doing is when they work that person up, and if they decide, this doesn't really feel like COVID, they'll still tell patients what to look for when they go home. So the big thing, a patient that is an outpatient, that would make us think maybe they need to seek. Now you're the person who needs to maybe go to urgent care or the ER, because again, this is going to be a heavy season, so we want only the sickest to go so our healthcare system isn't overwhelmed. But if you have difficulty breathing, sustained difficulty breathing, that's a symptom. There'll be other symptoms that doctors share with their patients. You know, if you see a change in how you're feeling, they'll tell you what to look for and to come back. So that's how it will work a lot. Like even with the flu, you know, you can be at home with the flu, but if you really can no longer catch your breath, you need to tell your doctor right away. And those kinds of guidance will be given by primary care folks.
With the 5 that are currently being tested, like how many of those are CDC and how many of those are Ohio or in Ohio at this point?
Okay, I will share with you that we have 9 negative people under investigation, no cases. Amazingly, we're holding out. I'm setting a pick on Ohio right now, trying to keep cases out, but you know, we will have one any day now. Of the people under investigation, 1 had gone to the CDC before we were up and running. 2 are in our lab as we speak, and 2 are actually at LabCorp. So we'll get those results, and there's a system, a technology system in place that actually we get those results right away as a Class A reportable disease.
And are these LabCorp, I know they're like a really big company everywhere, is it local LabCorp locations?
Yeah, there are local LabCorps that often primary care practices use. Sometimes hospitals do a lot of their own in-hospital testing, but there are certain tests they send out. Quest, and you know, the FDA waived the ability so more private companies could develop this. I think some hospitals will be doing these tests soon, and I think that you'll see more labs doing them. And little by little, our capacity will grow. I will also say at ODH, we're in the queue to get more ability to test more of the reagent when that becomes available through the CDC. And as I've said, this shortage, what we're seeing here is across the country, as you know. But what we're doing here in Ohio is we're maximizing our ability to use the resources we have.
When Governor DeWine said 300 to 400, is that at one time or is that the total amount that Ohio can test at this point?
Right now, that's the capacity our lab has. And I just, if for a second, I will be geeky and I will describe. Shall I describe
No,
it?
I think you should describe, though, why we couldn't test, why we now can start to test,
Okay.
and about the capacity, because the capacity has to do with what we get.
Okay, so I'm going to get really geeky here, so follow me on my math. And again, I will say again, it's so wonderful to have a governor who wants to go to all these places with you, and he does. So, so here's how the testing worked. The CDC, again, it's very hard for people at home to keep this in mind. This is amazing we have a test. I mean, the fact that we've had a test in this world this quickly is the stuff of science fiction. That's what PCR testing and these rapid tests have done. The CDC developed a protocol first, and they got that out. When we got the kits from the group that made them, there were some faulty reagents. A kit is just a bunch of chemicals, 3 reagents in particular that are important for this, that our already existing equipment can use and gets calibrated to and allows us to run these specimens. Now, when you get a kit, the kit we got, and this is very similar, and we know Wright Pat, by the way, got a kit too. They're doing military testing, though, not civilian testing. One kit allowed you to do 1,000 reactions. When we first got the kit a while back in February, like many other states, those reagents didn't work, if you remember that. And that's why we had to wait to get the test we got this week. So 1,000 reactions. Some of those, it's very geeky science, but are lost to controls. You have to do them to calibrate the equipment. And then, and this is the part that's very confusing when you see the numbers out there right now, each patient sends you 2 to 3 specimens. They do a nasal swab, sometimes an oral swab, and sometimes sputum. They make you spit if you can. And so of those, say 850 or something, now you have 2 to 3 specimens, and that's why we're estimating 300 to 400 people being able to be tested by this set of reagents, and we're hoping we get more reagents soon.
Governor, any updates on the Armed Sports Festival? Have they been in compliance with everything? What have you heard from that?
To my knowledge, they have been. I have no information that they're not, and I suspect I would have heard it.
And then also along those lines, any update on, you mentioned that if more people came to you with concerns of other large events, so for example, the March Madness tournament coming up, have anybody reached out to you at that point? Do you happen to know if anybody has a plan on how to handle that?
No, I do not. I mean, this is not something that when we looked at it, we already looked at it. And barring some dramatic change in what's going on in Ohio, we did not feel that that was an unreasonable risk. That March Madness certainly does bring a lot of people in, but again, it's different as far as the risk level, and that's what the doctors told us. So we've not changed our opinion of that.
Are you in contact with basketball officials? Because Wall Street Journal is kind of indicating there's a chance that it actually might be totally canceled.
Well, all I can do is, no, we're not in contact with them. My guess is that every group that is putting anything on is developing contingency plans in case they can't move forward. I think that you would expect that, and I suspect that's what's going on. But, our opinion is based upon what doctors are telling me has not changed about that. Anybody else?
As you all know, all of us in this room are constantly accused of fear-mongering with coronavirus. You all probably are accused of the same, or political opportunism or whatnot. But you called this news conference on a Saturday when there's no terribly significant update on cases in Ohio. Why?
We felt it was important as we move to a new phase, and the new phase is we now have the capacity in Ohio to test. New phase is we now have 2 private companies that are ready to test. So those are fundamental changes in where we are. We are reaching out today to primary care physicians. We're reaching out today to hospitals. And we were doing that not publicly. In other words, we were doing this with emails and other things. We felt it was important that as we reach out to these primary care physicians and hospitals and nursing homes, that we share that with the general public. Again, we want to be very open about this. We made a decision to have this press availability, press conference, just to do that. No, there was no huge news, but I think the news, you decide what the news is. That's not my job.
Governor.
I've been around long enough, but what's the important is we have a plan. And we want to make that clear to the people in Ohio. There is a plan. We've tried to outline what that plan is, and we're working to execute that plan.
And I do want to answer that because, I think one of the biggest issues we're facing is people on the ground, even physicians themselves, are really confused and they're afraid. And I think the testing has become something that is, there are conflicting messages about that. And so that really has become an issue. And people are calling up their doctors are calling up the health departments, people are confused. And in order for us to address this as a state, we really need to get the best information out there. And what was really going on right now is a lot of fear and confusion, and that's why we wanted to explain how Ohio is testing and how we'll go about that. And I hope, again, not everyone will understand that, but I hope that begins a process by which people understand it. And we're pushing out tons of information to every sector. We're working with hospitals, new stuff going out to doctors as we sit here, stuff going out for the general public on this. People are calling the hotline as we sit here trying to understand this. So we really owe it to them. This is an unprecedented time, and we really owe them the best information as we have it, and that's all sans politics. And you see whole house systems working together that often compete in industry. They're not. They're all working together, and that's what we have to do at a time like this.
Is there an amount of coverage talking about this, messaging news conferences that would be fear-mongering, or is it worth, is coronavirus dangerous enough to warrant all this stuff?
I think it is something we all are taking very seriously. We have not had an outbreak like this in a long time. We have not seen borders closed. This is something different, and it's going to change our ordinary lives. It's going to change. There are going to be absences. Businesses are going to have to take steps about employees being out sick. So the good news, and that's why trusted sources of information, coronavirus.ohio.gov, it's a CDC of information, overlaid with what's important for Ohioans. And that's why the 833 for Ask ODH. We want people to get the most, credible, good information. And it is, always, in times like this, there's going to be a lot of other information out there as well. So your help and the media has been great in this, and we really appreciate it because in a time of a public health crisis, the media is one of our most important tools to helping people. And if things get, messy, as they are in other states, we'll really rely on you to help us get good information out.
Sorry if I missed this, but who covers the cost of the test? If somebody is sent to, if the test is sent in, does that individual pay for it, or?
Yeah, so some of the testing will be paid for, and we haven't seen prices yet from labs. I know the federal government is working to prohibit this from being a cost gouging kind of thing, but regular insurance will cover it. Medicaid, CMS is working on ways to cover it. Any test that comes to our lab will be run. So, we will not let that be a limiting reagent to what we test. We do not charge, by the way, for any testing.
As folks head to the hospital to get those tests per doctor's order, is there anything in place, like a checkpoint before they even get in the hospital to kind of triage who may be possibly at risk with this and somebody else who's here for something else?
So every hospital has their own process and policy based on their facility and how that facility is set up. As I mentioned before, one of the best first steps you can do if you're the provider sending a patient to the emergency department is to call ahead. Even if you're the patient and you're going in to see your provider in their office, or you are going into the emergency department, if you think you have COVID-19, one of the best steps is to call ahead and let them know you're coming. That way they can be prepared. And typically what we train, it's a relatively simple process. If someone calls and says they're coming in with this, you put them in a mask and you get them in a room. You don't want these people sitting in a waiting room, coughing without a mask. Potentially other people that are there for sprained ankles and other things potentially could be exposed. So it's relatively simple. You put a mask, just a routine surgical mask on them, and you get them into a private room. And then the providers can don the appropriate personal protective equipment that's required and go in and evaluate the patient, interview them, assess them, maybe examine them to determine the need to do the test.
Anybody else?
With the lab workers, are they normally 7-day-a-week people, or are they having to do special because of this situation?
Our lab is geared up with 2 shifts, working most hours of the day, and our folks have been working 24/7 pretty much since this began. And I think on your first question, the hospitals you'll see this evolving. I think in the coming week, you'll see guidance from nursing homes. Each system will be trying to limit visitors and doing different things as this evolves to limit the spread of disease. So once again, stay tuned because it's evolving and we'll keep you up to date.
Thank you all very much.
There's a wedding at 4 o'clock in the rotunda, which I just wanted to let you know, so we can be kind of quiet on our way out. We're not invited.
We're-